So we did actually get some additional endocrine labs back afterwards, and as I think we showed you, his testosterone was also really low. So T2 is testosterone. So we started him on testosterone as an outpatient, although I don't think he stayed with it because he had a skin rash with the gel that we used. And he had initially been on dexamethasone to cause some or to reduce cerebral edema, and we transitioned him to hydrocortisone. And then he was referred for radiation therapy. But for reasons we can discuss, his radiation therapy took a little while to actually happen, and in the interim he was readmitted about 6 weeks after his biopsy with progressive headache and actually 2 partial complex seizures. And these are just his endocrine labs, which showed that they were actually fairly okay. He still had dilute urine, but his serum sodium was normal.
So this is before the radiation therapy, but after the surgery, and then you can see the post-surgical flap and then everything here, the resection site here, and then you can see again the enhancing mass in the supracellular region with some biopsy specimen taken out in this region probably, and then you can see this cyst is a little bit much better seen, or looks like enlarged, and then because of this complete obliteration of the third ventricle, you can see the ventricles are now much bigger, and then you see the subependymal high intensity giving this acute hydrocephalus findings. And then you can see this cystic component is much kind of round and then larger. And this is a coronal view. You can see the enhancing mass, but definitely the ventricles are larger, so that is causing a significant clinical symptom. And then now this is after the shunt is placed, right? You can see the linear structure here. And then this is after the radiation. So you can see the enhancing mass itself is obviously smaller. This hydrocephalus got much better. The ventricles are still enlarged, but it's much less subependymal flow signal. And here is the coronal view. The ventricles are smaller. So here is the pre-op imaging, and then this is the big ventricle, and then you can see the mass has decreased in size, and then ventricles are also relatively under control compared to previously.
This boy had a problem of I think he went 8 months or a year without a diagnosis with DI for a very long time, and it was going from one physician to another and getting misdiagnosed. And if you ask why it took 6 weeks to get radiation, this is what happens, that he probably could have avoided a shunt if he had been treated right away. But when you don't have insurance, that this is kind of what happens.